The following segment is presented by Bremo Pharmacy.
Flu season is upon us, and here to tell us how you can protect yourself, prevent the flu, and what you need to know about flu shots is Jenny Helmke from Bremo Pharmacy. Thanks for joining us.
Thanks for having me.
Now, first of all, nobody really wants to get sick, so what are some of the best safeguards that we can implement at home and at work so that we don't get the flu this fall?
Number one is keep clean. You want to keep your hands clean and help avoid touching your face, and make sure if you don't have a sink available, have some hand sanitizer around. Frequently clean your hands, clean your area, your workspace, your countertops, your cell phones. Germs live everywhere, so we want to make sure all of our spaces are clean. And if we do start getting sniffles and whatnot, use a tissue and make sure you're covering your mouth and nose, and toss that away and make sure you wash your hands right after.
So really frequent hand washing, and I see a lot of people, they cough or they sneeze into their hands, and I know a tissue is good because you can throw that away,
yes,
or even the elbow into, so that you're not spreading germs over everything you touch, right?
Yes. Because the flu virus is contractable by air. So coughing, sneezing, or just being around somebody who has the flu, you can contract the flu.
That's good to know, because a lot of people feel like they're afraid of the flu shot because they think, oh, I got a flu shot and then I got the flu. How do people really contract the flu, and what is the period of contagion, if you will, if someone gets it?
So if somebody's exposed to the flu virus, they may start developing symptoms in about 7 days. The one day before you develop symptoms, you can contract and give that to somebody else. So if two people are around each other and one person develops the flu and the other person decides, hey, let me go get my flu shot, they may actually have already been exposed to that virus before the flu vaccine takes full effect. It takes about 2 weeks for the flu vaccine to take full effect.
Okay, so that's why you tell people get your flu shot earlier in the season rather than later. So before there's a greater chance of being exposed, you can already be safeguarded.
Yeah, so if you get your flu shot now and help protect yourself throughout the season before all of the symptoms are out and about.
And just one flu shot will protect a person throughout the whole season?
Yes, the flu shot is developed based on the history and what's expected to be in this flu season. And they work up, and each shot has about 3 to 4 different strains, depending on the shot that you get, to help protect you for this season.
And who is most at risk?
Most people are, well, the CDC recommends that everyone ages 6 months and up gets the flu vaccine, and there is one for every different type of person available out there. But people who are most exposed or most at risk are those people who have chronic conditions such as respiratory issues, the elderly, the small, the frail. But it is recommended that everyone gets it so you're not exposing your family to the virus as well.
Right, you can get something at work, bring it home, or vice versa. And then lastly, I keep saying flu shot, but you also have a nasal vaccine. How do you determine who gets what, and does a patient have a choice in that?
Yeah, so there are a few different types of vaccines available, not only the nasal mist, but there is a flu shot as well, so enter the muscle. And when a person comes into the pharmacy, we will have them fill out a form and evaluate which vaccine is going to provide them with the best protection. And if they're eligible for the flu mist, then we can provide that for them. It is only available for non-pregnant women and healthy adults aged 2 through 49.
Well, thank you. That's good information. And if you at home want to find out how to sign up for your flu shot early, just visit BremoRx.com.